was a patient who came in one day, and I was going through his labs, and I found that his creatinine, normal being less than 0.9, was 2.8, and his GFR, the function of the kidney, was 30. So when I looked at those numbers, I said, hey, this is odd. Something's wrong with your kidneys. What are you doing wrong? So he says, I'm not doing anything different. I'm doing what I'm doing every day. I said, look, in the past, 2 years ago, your kidney function was completely normal. Today, you have stage 3, almost going to stage 4 kidney disease. And you must be doing something wrong. Either you're consuming a lot of alcohol and causing dehydration, or you're taking a fluid pill, which is causing dehydration, or you're drinking a lot of caffeine, or you're taking some non-steroidal anti-inflammatory drugs or some other medication that's causing damage to the kidney. So he says, wait a minute, I've been taking Advil 800 milligrams twice a day for the last 6 months. I said, why would you do that? Because I was having some soreness in my left wrist. So my friend, who's an orthopedic surgeon, said, hey, if you have got some soreness, just take some Advil. That should take care of the pain. So I've been taking Advil 800 twice a day, and I've had no further problems. But I've continued it for the last 6 months because ever since I took that, my pain has gone away. What's the moral of the story here? Advil, taken twice a day for the last 6 months, destroyed and killed his kidney. Another story. A friend of mine decided to play golf. Before he started playing golf, he had a cup of coffee. At the end of the game, he came back, sat down with a group of other friends, and decided to have a couple of beers. And since he played golf and the day before that he was doing gardening, he was sore all over. So he decided to take Advil. So he took 800 milligrams of Advil and then went home, and life went on. Next day when he tried to pee, he realized that his urine was concentrated and was only a few drops. So he didn't like what he saw, so he decided to go and see his primary care physician, who did blood work on him and told him that, hey, you did something wrong because right now shows that your creatinine has gone up to 4 and you're in renal failure. He had to be admitted to the hospital. He spent almost 2 weeks in the hospital. After a lot of IV fluids and some support, his kidney function did improve. But what was the reason why his kidney function got affected? It was dehydration through caffeine, playing golf outside, and not hydrating himself and drinking beer, and then taking Advil to get rid of his pain, which sure enough did help him with his pain, but in the process did kill his kidneys. Another patient came in and he said, well, for the last 3 years I've been taking Tylenol PM. I said, why? Oh, at the end of the day I have got all these body aches and sores, so when I take Tylenol PM, I tend to sleep well and I feel good next day. So I said, remember, Tylenol is a medication that you take for pain, but if you take it chronically for a long time, there's a chance and a risk that you could destroy your liver. So I advised him to do a fibroscan. Fibroscan is a tool, it's an ultrasound where we do in the office. It's a 10 to 15 minute test. It's an ultrasound of the liver, and it will tell you if your liver is normal or fatty or scarred. Guess what we found? His liver score was suggestive of severe scarring, almost close to having a cirrhotic liver. So I had to send him to a liver doctor who evaluated him and told him that basically his liver damage was because of taking Tylenol. Every time anyone who has pain or aches in this country, what is the first go-to drug? Non-steroidal anti-inflammatory drugs. What's the second go-to drug? Tylenol. Sometimes people take both Advil and Tylenol together because they feel it seems to work better in getting rid of the pain. What's the third go-to drug? It's aspirin. One lady comes to the office. She says, I'm having a lot of chest tightness. And every time I have chest tightness, I take an aspirin. Not a baby aspirin, but a regular strength aspirin twice a day. So we decided to do an angiogram on her. When I got access to the artery, I realized that the blood was too thin and she was just bleeding and oozing like crazy. And when we took the sheath off, instead of 6 hours, we had to keep the weights on her for almost 12 hours. We had to put pressure on the groin for almost 12 hours to let the clot form. Later on, we found out that her stools were positive for occult blood. And we called a gastroenterologist who scoped her and found that she had severe gastritis. And she was bleeding because of the gastritis. And the cause for the gastritis was aspirin. Lucky she did not bleed in her brain. I know of 2 physicians who were both taking baby aspirins, and both at different times fell on their buttocks for whatever reason. No major injury. They got up and life went on. Both of them 2 weeks later started noticing unsteady gaits and severe headaches. And both being physicians decided to get CT of the head, and guess what? Both of them had large extradural bleeds. That means bleeding around the brain, between the lining of the brain and the skull, and the bleeding was so big that the clot was actually compressing one side of the brain, which was now pushing the brain to the other side, and had they both waited for 1 to 2 more days, they would have died. And what was the cause for bleeding? Aspirin. So let's start with the topic. Are over-the-counter painkillers killing your liver, kidneys, heart, stomach, and putting you at risk for heart attacks and bleeding complications? So, over-the-counter pain medications. What do most people take? Aspirin, acetaminophen, which is also called Tylenol, and non-steroidal anti-inflammatory drugs. So these are the usual 3 drugs most people take. Of the 3 drugs, the most common used one are non-steroidal anti-inflammatory drugs, namely Advil, Motrin, Aleve, Naproxen, Ibuprofen, Meloxicam, Celebrex. These are the ones which most people take. Second is Tylenol. Third, of course, is aspirin. Now, how do these medications affect you? You have liver. We all have a liver, we all have a stomach, we all have 2 kidneys, and we have arteries which supply blood to all over the body. Now, let's start with aspirin. When you look at aspirin, when people take aspirin, what happens? It thins the blood and it causes gastritis. These are the 2 major complications of aspirin. There are a lot of other side effects, but of the side effects, the 2 major ones are what? Thinning the blood and gastritis. Now, as I told you earlier, when you thin your blood, you run the risk of bleeding in the brain or bleeding around the brain, not to mention bleeding in other different organs. But more importantly, it's the bleeding around the brain and in the brain that's more dangerous. So, aspirin can cause gastritis, aspirin can thin the blood, and when you take aspirin, regular strength, you usually thins the blood for at least 7 days. Next is Tylenol, acetaminophen. Taking too much of Tylenol can cause liver damage, and especially when you have COVID or other infections, what do you take? You take Advil and Tylenol, and when you take it every 4 to 6 hours, what are you doing if you're taking Tylenol every 4 to 6 hours? You're actually destroying your liver, and you could actually have severe damage to the liver. If you were to check the liver enzymes, they would be really through the roof. So think of it this way. The major complication or side effect of Tylenol is liver damage. If you take it acutely, you can have liver damage, and if you take it chronically, you will have scarring of the liver leading to cirrhosis of the liver. Be careful. The next one is the non-steroidal anti-inflammatory drugs. When you take this, 1, it can cause gastritis like aspirin. 2, it can thin the blood for 24 hours like aspirin, but unlike aspirin, it only thins it for 1 day. 3, unlike aspirin, where aspirin protects against heart attacks, non-steroidal anti-inflammatory drugs are notorious for causing plaque ruptures. That's why, if you remember, there was a case against Merck on a drug called Vioxx. Since people who took Vioxx had actually plaque ruptures and heart attacks, they went after the company and the drug was pulled out of the market. So non-steroidals can cause plaque ruptures and heart attacks. They can also cause severe kidney disease. Now, most of the damage because of non-steroidal happens when you are dehydrated. So if you plan to take an Advil or Aleve, make sure you take the lowest dose, make sure you take it on a full stomach, and make sure that you are not on caffeine or alcohol, and make sure you are well hydrated. If you are given a choice between non-steroidal anti-inflammatory drugs versus regular strength aspirin, I would take a regular strength aspirin and Tylenol to help with the pain as a first line of defense. Second, if it persists, then maybe take a Motrin or Aleve, but always remember, on a full stomach, and make sure you're well hydrated, and try to stay away from caffeine and alcohol, because these 2 agents are notorious for causing dehydration. And if you have dehydration and you take an Advil or Aleve, it is going to cause some significant damage to the kidney. What else does Advil or Aleve do? Water retention, leading to increase in blood pressure, leg swelling, shortness of breath, and can put you in congestive heart failure. So, of the three, which one has the least side effects? Tylenol. Second is aspirin. Third is Advil or Aleve. Given a choice, what should you go to? Tylenol and aspirin together to help with relieving of pain. If you continue to have more symptoms, then take Advil, but go for the lowest dose and make sure you're well hydrated. And if you already have a kidney disease or a problem with kidney, or if you have uncontrolled high blood pressure leading to kidney failure, or if you are taking fluid pills like hydrochlorothiazide or Lasix to get your blood pressure under control, like diuretics, then don't take Motrin or Advil, because when you take the fluid pill and cause dehydration, you take this, you're accelerating and accentuating the damage to the kidney. So how can you protect yourself when taking non-steroidal anti-inflammatory drugs? Hydration, hydration, hydration. That's a key. Thank you.